I am Dr. Madhu Goel, Director Obstetrics and Gynaecology at Fortis La Femme, Critical Part 2. So we are going to talk about cervical cancer. Cervical cancer is the cancer of the cervix. So this is your reproductive organ. This is the uterus, and the mouth of the uterus is called the cervix. Cancer of this part of the uterus is called cervical cancer. Cervical cancer is a very common cancer in Indian women. In fact, it is the commonest genital cancer in Indian women and is responsible for considerable mortality of cancer in India. Cervical cancer is caused by human papilloma infection. Actually, human papilloma virus is a very common virus affecting individuals passed on from one individual to the other through sex. So what happens is, usually the HPV infection clears off after a while, but in certain individuals, certain types of human papilloma virus can stay longer in the body and eventually cause cancer. These cancers are more common in women who are sexually active at younger age, in women who have multiple sexual partners, with poor vaginal hygiene, and in smokers. However, the truth is that the cervical cancer can occur in any person, any individual. Hence, screening for cervical cancer is very important. When we talk about screening, it is done through a simple test called Pap smear. Pap smear test is done in the OPD. You can simply go to a gynecologist for the Pap smear test, and this is how the Pap smear test is taken with the help of a simple brush. So it's not a painful test. All we do is we put in the brush and take a few cells from the cervix and send it for testing. The Pap smear can detect not only cancers, but it can also detect any infection, any inflammation, or it can pick up precancerous lesions. That means lesions where the cancer has not yet developed. Another thing that you can do to prevent cervical cancer, and very importantly, is that get your vaccination done. Cervical cancer is the only cancer against which a vaccine is available. So this vaccine actually is preferably given in the age group of 11 to 13 years of age. However, we can give it from 9 years till 45 years of age. If given before the age of 15 years, it is given as 2 doses at an interval of 0 and 6 months. If it is given after 15 years, it is given as 3 doses, 0, 2 and 6 months. The cervical cancer vaccine protects us against not only cervical cancer, but also against genital warts, against vulval cancer, some protection against anal cancer as well. So do get your shots today. So a combination of Pap smear and a cervical cancer vaccination goes a long way against preventing cervical cancer. The signs and symptoms of cervical cancer are heavy periods, bleeding in between your periods, bleeding after intercourse, and foul-smelling discharge. If you have any of these symptoms, please contact your gynecologist immediately.